Hi, I'm Karen Furr, and I am a vascular access nurse. I have done vascular access for almost 5 years now, and it has been by far my favorite specialty. I absolutely love the opportunity that we have to share specialized skills with patients in a way that makes their experience a little bit better or a little bit less painful or less stressful for them. So, as a vascular access nurse, who we serve varies a little bit based on where you work. And so, for instance, in some facilities, vascular access nurses are focused on those who are difficult to gain access on, patients who are difficult sticks, who have already been stuck by another nurse, a staff nurse, or an ER nurse, and have not been successful, and so they need the vascular access specialists to come in and give it a try with some extra tools or experience, training that we have. In other facilities, everybody gets vascular access nurses for their IV starts. And so it really depends on how each facility is set up as to who we serve. But from a patient population standpoint, we serve anything or anybody from birth through end of life. And so the ages can range really throughout all of the ages and stages of care. Anybody who needs vascular access. And so that can be as simple as someone who needs an IV for fluids or for medication, or even just for a PRN seizure med, or for a procedure for a CT scan. It can also be something more extensive like a midline placement or a PICC placement, peripherally inserted central catheter. And this is something that a lot of vascular access or IV teams also specialize in, is the placement of PICC lines. What I wish I had known before I started vascular access, and what I wish people would understand, is that there is so much more to vascular access than just being able to start a good IV or to start an IV period. Depending on the situation, there are so many factors to consider about the placement, the size, what's going to be going through that catheter, and so which vessel is best. There's things to think about based on the age and status of the patient, whether it's an infant or a toddler, or a patient who's immobile, or a patient who is paralyzed and doesn't have feeling in their legs. There are a lot of different considerations, more than just I see a vein and I can get a catheter in it. I wish that I had understood that before I took on the job. I might have been a little bit more humble as I started that role. But I will say that I have learned so much in my role as a vascular access nurse about how we can be advocates for vascular health for our patients, short and long term. We can think about if they're getting a medication that can be really irritating, let's put it in a bigger vessel. If we're putting it an IV in a toddler or a child who's going to be moving around and not compliant maybe with our requests to be still, let's avoid the ACs or the feet if it's a child who's learning to stand. There are a lot of different things to think about, whether we're using their dominant or non-dominant arm. Do they have lymphoma? We need to avoid one side. There are just a lot of considerations that sometimes we don't think about. We just think, I see a vein, I can get it in, and that's all that matters. And if it's a critical situation, sometimes that is all that matters in that moment until you can get stability for your patient and then look for something better. One thing I would say for those who might be interested in vascular access is to see if you can shadow a vascular access nurse for a day to really get an understanding of all the things that they entail. I know in my pediatric setting, when I worked in a pediatric hospital, we even did central line repairs for patients who came in and had a tear or a break or a hole, or they bit through their central line. We would actually repair those lines by cutting closer to the site and using a repair kit to glue a new end cap or a new end piece on. I never even knew that was possible until I became a vascular access nurse. And so we do a lot also of troubleshooting with central lines. Even lines that we don't place, we still are the go-to experts for maintaining and troubleshooting those lines when there's a problem. Looking at the x-rays to see if the central line or the PICC line is still in the right place. Looking at the length to see when we pull them out if anything broke off, if there's something we need to consider. If they're not flushing or giving good blood return, we're the troubleshooting go-to to figure out what might be the problem, for dressing changes and things of that nature. So there is a lot more to consider than just can you start an IV. And I would recommend, if you have any interest, or if you're a person who enjoys skills-based work, you would or task-based work, I really recommend that you look into vascular access. It's a very rewarding career. You have the opportunity to see a large number of patients for a small amount of time, and you can really make a huge impact, especially for people who get regular IV sticks or port accesses. Your skill and ability to do those things well and with finesse and with the competency that comes with doing them on a constant basis really helps improve that experience for them. So maybe they can't avoid having a port access or having an IV, but you make the experience better because you have the expertise to do it well and to make the right choices in placement, in type of catheter or needle that you're using. And so if you have any questions about vascular access nursing, I would be happy to answer those. You can email me at furr.karen@gmail.com. That's FURR.KAREN@gmail.com. Thank you so much for the opportunity to share about vascular access nursing.